Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Is IVF a dangerous procedure? This is a question that many people ask us when we suggest them to go for an IVF cycle. When all else fails, when IUI, intrauterine insemination, ovulation induction fails, or you are of advanced stage, or there are some reasons why we suggest you to go for IVF directly, this is the first thought that comes to most patients. Well, IVF is a procedure, it's a medical procedure like any other medical procedure, and there is a small surgery involved, as in there is a procedure with anesthesia involved. You are under general anesthesia and a needle is put inside your body to remove the eggs which are growing in your ovaries. So proper instructions should be followed and all advice that your doctor gives should be followed to the T. But let's talk about a few side effects or a few things which could not be very good in IVF. There is a risk of multiple pregnancies. Yes, it's very happy when a patient gets pregnant after many years or multiple attempts, but multiple pregnancy is never too good because it could lead to preterm deliveries, it could lead to gestational diabetes or hypertension. There could be complications to the baby and the mother. So it's always better to aim for a singleton so that there are no complications to the mother or the child. Next is ovarian hyperstimulation. All these medications which are given to grow eggs in the ovaries, sometimes the patient over responds, as in too many eggs grow, and this could lead to complications such as ovarian hyperstimulation, where it could be life-threatening as well if not treated. Of course, it's very rare nowadays because dosages which are given are very controlled and are aimed at growing certain number of eggs. Also, management of OHSS, if occurs also, is very good now. Then there is the risk of ectopic pregnancy. If a pregnancy does not occur in the uterus, in the endometrium, and occurs elsewhere outside the endometrium, then it is called as an ectopic pregnancy. Usually it occurs in fallopian tubes, which could not be a very good news for the patient because either the tubes are removed or tied or blocked. So this is one of the complications which could not be very good for the patients. There are some birth defects as well. It has been proven in studies that birth defects occur more commonly in IVF children than in normal population, but more studies have to be done, more data has to be presented for this to be asserted properly. Of course, there is the next problem of emotional and financial stress. There is a lot of expenditure that a patient incurs which could not be affordable by every patient. Also the emotional stress, because you may not be responding properly to the injections or medications. You may not give the right kind of embryos from the eggs that you've given us. Sperms may not be good, or you may end up in a negative from the IVF. So all these things make up for a roller coaster ride in IVF, which has to be properly counseled to the patient. All these side effects that I have talked about, you can discuss with your fertility specialist, and all side effects do not happen to everybody because IVF is very customized. Each patient has a different problem, and to address that problem, the fertility specialist will give you the right kind of dose, do the right kind of protocol so that you do not have any complications from IVF. If you want to understand more about IVF, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.